At this time, we are going to call to order the Consumer Assistance Advisory Committee with the Silver State Health Insurance Exchange, and I would ask Mr. Hager to take the roll.
Mr. Downey.
Present.
Miss Ellis.
Present.
Miss Joyner.
Here.
Mr. Mazzoni.
Present.
Mr. McCoy.
Here.
Miss Periotti Boothman.
Present.
Mr. Rodriguez. And Mr. Rodriguez indicated that he wouldn't be able to attend. Vice Chair Lewis also indicated that she wouldn't be able to attend. And Madam Chair.
Present.
We have a quorum.
Thank you very much. And I don't think I did, but I wanted to welcome everybody to the meeting. Thank everybody for coming. We have some public here down in Las Vegas. I'm assuming there's some public in Carson City, and it sounds like we have some people on the phone. If I could also just remind people on the phone not to put us on hold, but please put us on mute, and don't put us on hold, especially if you have music coming through. So I just in advance want to ask you to do that. If there's no other, and Mr. Hager, do you have any other announcements before I address public comment?
No.
So the item 2 is public comment. I'm going to be taking, we're going to be discussing agenda item 6 actually after we do the approval of the minutes. Well, no, I'm sorry. We're going to take agenda item 6 before agenda item 5, primarily for staffing reasons, because Mr. Hager is going to have to leave the meeting a little bit early, and so I want to make sure that we get to that. I would like to ask anyone who has public comment primarily on agenda item 6, now is your time. We will not be doing public comment before that item. We will be doing public comment again, though, after the discussion of agenda item 6. But if you do have comments about agenda item 6 in particular, now is your time to speak before our discussion begins. So please either step forward or indicate on the telephone if you would like to make public comment. Again, we are going to limit it to 3 minutes, and I'm going to ask staff in Carson City to keep time if necessary, and we will start down here in Las Vegas. We do have someone at the table. If you could state your name and who you're representing.
Madam Chair, this is John Hager. Just for clarification, the public comment that you're going to receive on item number 6, you said was going to be after discussion. Is that before the vote on the item?
Yes.
Thank you.
No, so anyone who would like to comment on it before we begin discussing it, please do that now, and then after we discuss it before we vote, we'll open it up again for public comment.
Good afternoon. For the record, my name is Barry Gold. I'm the Director of Government Relations for AARP Nevada, and I thank you for the opportunity to speak on this agenda item. What I'd like to talk about for a moment is the training requirements for navigators. And while I understand it's very important, and I agree with all the sections and the amount of time you do on that, I want to talk about some of the agencies that will be navigators. Some of these are very small community agencies, maybe nonprofits. They have a very short staff, lack of staffing, and the amount of time required for this training could be burdensome to them. And I'm wondering if it would be under consideration that this training could be broken up. Doesn't have to be in 3 full days. Could it be done in separate times to accommodate their ability to take this training? Because a lot of these are very small community agencies that wouldn't be able to devote entire days. And the other thing to consider in your deliberations before voting on this is a lot of these agencies also rely on volunteers or part-time staff that actually do a lot of the work involved in this. So the question is, will every single person who utilizes part of the functionality of a navigator be required to take the entire training, or could certain people from the agency take the training and then some of the volunteers be trained on the parts they will doing? You know, I'm not making recommendations specific to that, but I want you to be aware that this is what's happening in the community, and to make this work for these community agencies who have volunteers, that really they can't ask them to commit to 3 full days of training in one shot might be very difficult. But we really need these community agencies to provide this vital function across the state, and those are my public comments. Thank you.
Thank you very much. Is there anybody in Carson City?
Have one here.
Good afternoon. My name is Elisa Cafretta, and I am here on behalf of Nevada Advocates for Planned Parenthood Affiliates. We have 5 health centers in Nevada. We have over 50,000 patient visits a year. And I submitted this morning some specific public comment regarding specific lines in some of the staff reports that you have. It would be probably helpful for all of us if the staff reports had unique numbers so you could tell which which paragraph I was referring to as I was going through with specific comments. I will trust that you will get those, and I'm not going to address each specific point. What I just wanted to focus on overall, seeing some of the other public comment that you have gotten, is that we haven't sort of made any big effort to rally the troops to sort of lobby all of you on behalf of the need for separate navigators who will have an independent role from the brokers. If that's something that becomes necessary, we would be happy to do it. But I just want to emphasize that there are 500,000 people in Nevada without insurance or not in the system currently under Medicaid or CHIP. And these are people who have never been in the system and will really need some assistance from these community-based organizations, these nonprofits that Barry Gold was talking about. It's a different kind of education process. It's a different kind of approach. It's not just a basic business transaction. And so I would stress greatly the need for independent navigators. I'm very concerned about the recommendation that navigators just refer people to brokers. There's a reason that these people don't currently have insurance, and I don't even know if we have enough brokers in Nevada who could serve this need. That's why there's this envision that these community groups would get involved. One very specific concern that I have about the recommendations in one of the reports is the exclusion of providers for being navigators. It's not guidance that's in the Federal Register in terms of people that are excluded as navigators. It's envisioned that anyone getting a commission from an insurance company would be excluded, but the way it reads in the staff report that you have is that anybody who got any money from insurance, even if it's a fee for service, would be excluded, and I don't think that that was the original intention, and that would be a concern for us, for health departments, for community-based health centers or federally qualified health centers. So I hope you would look at fine-tuning that, and I'd be happy to answer any questions. But that's my comments.
Thank you very much. Las Vegas?
Thank you. My name is Greg Clemenson, Clemenson Insurance Services, and kind of wanted to comment a little bit about what Mr. Gold had to say with regard to training of navigators. He seemed to think that the training should be abbreviated or something for the outlying areas. And on the summary attachment that was sent out, it has to do with the training of navigators would be done through the exchange. And I think that the citizens of of Nevada are entitled to the same protection under the Nevada revised statutes that essentially says that somebody that's selling or soliciting or conducting insurance needs to be licensed by the insurance division. And the navigators are essentially selling insurance. In fact, under the Silver State Insurance Exchange, Chapter 695I.200, it says that the health insurance exchange is established to facilitate the purchase and sale of qualified health plans to the individual market in Nevada. So what I'm saying is that it would be all right with me if the navigators sold insurance. Don't have any problem with that. I believe that they should be held to the same standard that I am in order to protect the consumer equally. Thank you very much.
Thank you very much. Is there anybody else in Carson City?
There is.
Good afternoon. My name is Patricia Porter. I am an agent, an independent agent, a broker. And my comment is related to A through A from this point 6. It's not really a specific comment is about one of the points, but I just would like to say this out loud. I know, and there's no doubt, that we live a political world. There's no doubt about that. However, I would like to see that in this discussion there is more than who do we vote for, and we take in consideration the big value that agents bring to the community. This is about how we serve and service our community. This is about how much we help people when there is concern, when there is confusion, when there is chaos about what to do, where to go. Regardless what is our religion or where we put our vote for, this is about, I would like to see this discussion from the perspective, not the agents looking for a little opportunity to be squeezed in this picture, but about giving the agent the value to participate, to actively participate, and have a strong participation in this. This is not how can we fit in this, is here we are, this is how much we have serviced our community, and we want to be listened. Thank you very much.
Thank you very much. Is there anybody else in Carson City that would like to make public comment at this time?
There is. He's coming up.
Let me turn it on. Mike Lyons, I'm with Nevada Insurance Agency and also a representative of the Northern Nevada Association of Health Underwriters. I know that you had received something from us in the public for the public comment already. I'd just like to go over that really quick. The definition of what the navigator versus broker. I think there's a misnomer out there that we don't educate and we don't talk to our clients while they're going through the process of purchasing insurance. I just want to let you know that we do. We spend quite a bit of time with our clients on a day-to-day basis, helping them understand the policy, helping them understand what an EOB is, helping them understand going through their claim situations. Also, I think the licensing and the certification training, as Mr. Gold was speaking about, trying to split that up or having somebody else do it and then just pass that information on to the other people. I don't think that that's a good idea, only reason because when I started in this career, I spent one whole year with my father in the business before I could even go out and sell and talk to individuals about buying insurance. The thing is there's so much education involved, not only from the standpoint of the what products the carriers offer, but again, back to explanation of benefits, claims issues, all those kinds of things. So I think that it would be very important that they do go through the full scale of training, and I would even say maybe a little bit more. Compensation structure. Again, I think in our notes we agree that if there is a navigator that is selling insurance, it's done by a grant, and we as brokers, we get paid commission directly from the insurance carriers. Performance metrics, I think, is very, very important, whether it is a navigator that is selling or if it is a broker that is selling. I think, and I'm not sure how it would be put together, but I think the exchange would have an online survey that can be done whether a navigator was the one that talked to them about the policy or if it was a broker agent. And in the state of Nevada, there is, I would say, and this may be a number that's a little a little low, but I think there is around 8,000 broker agents on the healthcare side, or on the health insurance side. Thank you.
Thank you very much. Las Vegas?
For the record, my name is Peggy Mays Johnson. I'm with the Consumer Assistance and Resource Enterprise. I think it should be noted on the record, I hope I'm not interpreting what the recommendations are, but I believe that the navigators are not going to be selling insurance. And I think a model of that is what CHIP does. You know, they assist, but they don't sell. And I think that that's a misconception that people have. And I just think that that should be on the record. Thank you.
Thank you very much. Is there any further comment in Carson City?
Yes, ma'am. For the record, I am Trey Abney, representing the Chamber of Reno Sparks in Northern Nevada, our 2,500 members of the Chamber of Commerce. I want to associate myself with the comments of the previous speaker in Carson City. My organization also fully supports the white paper that this committee received from the Northern Nevada Association of Health Underwriters. And I wanted to quickly confirm with Mr. Hager that the letter that the Chamber sent went out to this committee as well, and so you should have our points there. I won't try to belabor the point, but I think it's important to point out, first of all, I know this committee and the exchange itself has a very difficult task ahead of it, and we're here to help the outreach to the business community and the individuals, employees that our members employ. I think it's important to point out that brokers and agents serve a vital role in the process. They have been the original navigators, if you will, for employers and for individuals. The Chamber itself has an insurance broker, somebody that we can call her on her cell. We can email her and get a hold of her anytime we need to determine and go through the maze that is the health insurance industry. And I think that's important. Your navigators won't be able to do that at the state level. They will be a first point of contact. They'll be a great educational resource. But once that policy is sold, once they're on a health plan, you will need a broker, an educated, licensed broker with that experience to help folks through the process. So we don't want to reinvent the wheel here when we have a full, robust private sector industry here that is ready, willing, and able to serve these consumers and these employers. So we appreciate your time and again, fully support the Northern Nevada Association of Health Underwriters, and thank you for your time.
Thank you very much. Is there any further public comment in Carson City?
No.
It does not look like there's any in Las Vegas. There is. One moment. Come up, sir, please. Is there any public comment on the telephone? I'll take that as a no, and we have one more person down here in Las Vegas.
Good afternoon. Dan Heffley, for the record. I'd like to thank the subcommittee for all the hard work they have put into the task before them. I'm especially appreciative that the committee understands many of the intricacies involved in the health insurance purchasing process and recognizes that navigators should complement the services provided by licensed insurance producers, intending to reach underserved populations that may not have the ability or means to travel to a producer, such as the Native Americans on reservations, or those individuals that may qualify for publicly funded programs such as CHIP and Medicaid. However, I agree with and endorse the Chamber of Commerce and the Northern Nevada Association of Health Underwriters' suggestion that navigators ultimately should facilitate enrollment into a health plan by referring out to the appropriately trained area, be it the appropriate governmental agency such as GovCha for CHIP, and Medicaid enrollment, or a properly trained and licensed insurance producer for private market insurance plans. This rationale is twofold. Point number one is at the point of purchase. This is perhaps the most critical. While the committee has done a laudable job at identifying what a consumer needs to know, facts, in the absence of context, may not do the consumer justice. Two brief examples follow. A consumer may desire a lower premium plan that covers outpatient prescription drugs, only to find out after purchase that the particular plan they chose doesn't include the drugs they are taking on the plan's formulary, whereas a slightly higher premium plan would have. The second point, a 25-year-old male may purchase the lowest priced plan available, only to pay a substantial deductible upon arrival to an emergency room, or worse, not get care because even a $500 deductible may be prohibitive. A licensed producer could instead make the recommendation to purchase an accidental medical expense rider on a plan outside the exchange which would pay for any number of accidental injuries up to a certain amount before a deductible would have to be met. Knowing that statistically, if a male before the age of 38 were to go to an emergency room, it would in all likelihood be the result of an accidental injury, not a heart attack or a stroke. These are but two of the myriad number of intricacies that a newly licensed navigator would not have working knowledge of. Point number two is the underserved populations, by definition, would not have the experience to understand the full extent of the healthcare system, and as such would require substantial service after the point of purchase. A few very brief examples are a physician's office may accept an individual's insurance card, but it may not be contracted. The result is that the consumer winds up paying more for that visit than what they thought they would. Or a consumer receives an explanation of
Mr.
benefits.
Heffley, that's 3 minutes.
Thank you.
Thank you very much. Looks like we have one, and we do as well. So we'll go to Carson City.
Hi, my name's Pete Gilbert. I'm with Employer Benefits. I've been in the insurance business for just selling mostly medical insurance for 31 years. When I get a phone call for insurance and they're going to come into the office, usually they'll ask me, how long is this going to take? And my average appointment is about an hour. So, and based on fact finding and talking to the prescribed client or prospective client, I can sit down and ask questions and find out exactly how much they know. I mean, sometimes I sit down with people and they don't even know what a deductible is. So it's important that when they walk out the door, as far as I'm concerned, there's two things that they need to know. They need to know what they're buying, and it needs to be affordable for them. So I make sure that it falls into those two categories and that they understand exactly what doctors to go to, what hospital, and all that, because they want to get their best bang for their buck. And I think they do that through a good insurance agent. So that's all I have. Thank you very much. Appreciate your time, and you guys are doing a great job.
Thank you very much. Las Vegas.
Good afternoon. Mark Jolly with InsureMonkey. Can I ask how the definitions and the recommendations that are before you today have been put together? Where did those come from?
I think. Go ahead, Mr. Hager.
Well, I'm not sure what definitions we're talking about.
Specifically referring to the definitions of a navigator and a broker.
Yeah, I think we're going to talk about those sorts of things today. So if there's questions that you want us to address when we get to that section, if you want to go ahead and talk about them, because this can't kind of be a back and forth dialogue, unfortunately. So any public comment or any questions you want us to address when we get to that section would be great.
I appreciate it. So for the record, it occurs to me that we are in a unique and fortunate position right now. Our governor and our legislature decided to take a leadership position within this country and organize around a health insurance exchange, primarily so that Nevada could organize this structure in a uniquely independent and uniquely Nevada fashion, so that we weren't subject to what the federal government decided to do and impose relative to health exchanges should a state not choose to go forward with organizing its own. In discussions with various folks, in various industries, it occurs to me that is there a delay?
If you're listening on the internet, can you please put your phone on mute? We've got your time stopped, so we'll Again, if you're on the phone, can you please put your phone on mute? Thank you very much. Go ahead, sir.
I appreciate the comments that have been made today, earlier from my friend Lisa in Northern Nevada. I think the comments that you're hearing today underscore what I would ask of the committee today, which is to not adopt the recommendations that are before you, but in fact to respectfully request that staff go back and meet with Nevada's brokers and broker community, meet with the individuals and organizations who are envisioned to become navigators in this state, meet with consumers and consumer groups to in fact inform a recommendation that can be brought back before you that is uniquely independent and uniquely Nevadan to serve the intent and the purpose for which the governor and the legislature organized this body in the first place. Thank you.
Thank you very much. Any further public comment in Carson City?
Hi, I'm Peter Breen, an insurance broker, and I just wanted to make a brief comment with regard to the term selling. I've been a licensed broker for almost 20 years, and I hate the connotation of selling. I've never sold anybody a policy, so to speak, as if somebody walks on a car lot and they're sold a car. It's more, we work in an advisory capacity, basically a consultative capacity, so somebody approaches us. Have we prospected? Yes, but we only are able to serve. If we can't serve somebody, then we don't get paid. We move on to the next opportunity. Or if somebody comes into our office and says, I need a policy, or I'm interested in a policy, we advise them, we consult with them, but we don't, sort of swindle or influence somebody in a bad way. That's sometimes the connotation of selling comes across, and in many times we're not able to help somebody in a way that we can earn a commission, so we direct them to the best option for them. I've sent many clients to Access to Healthcare. I've sent many clients to the SHIP program or Medicaid program, or the I forget the name of it, the program for children, child-only plans in Nevada. And I didn't get paid for those services, but I certainly don't want people to go without coverage that they qualify for. So it's already happening this way. I know we've done it. I know many of my colleagues have done it. So the connotation, I just wanted to kind of add a comment to that connotation of quote-unquote selling. It's not necessarily that we're really serving in an advisory or a consultative capacity more than anything. Thank you.
Thank you. It looks like we're done with public comment in Las Vegas. Is there any further public comment in Carson City?
This time it doesn't look like there's any more.
With that, public comment is closed. Mr. Hager, if we can do item 3, approval of the minutes.
For the record, John Hager, so the minutes are provided from the June 8th Consumer Assistance Advisory Committee meeting. If there are any changes that the committee would like us to include, please let us know. Otherwise, if the chair is amenable, we would entertain a motion to approve.
I so move. Randall Downey for the record.
Tom McCoy, I second.
Thank you. With a motion and a second, any comment?
And
or any discussion?
The motion was from Mr. Downey, and who was the second from?
Mr. McCoy. All in favor, say aye.
Aye.
Aye. Any opposed? Motion carries. Mr. Hager, did you want to go over item 4?
Yes, briefly, for the record, John Hager. Agenda item number 4, the status of work completed by this committee to date is very similar to the ones that you've received in the past. The calendar provides the dates, some of them not entirely accurate because of changes to the schedule, but they provide the expected month at least when we expect to provide this information to the board. It could be delayed if necessary. We were hoping to get a decision on mainly on navigators, but also on brokers and potentially assisters at this meeting. But if there were a delay, we could deal with that it would be preferable not to have another committee meeting about this again, because we've had quite a few of these meetings about this particular issue. But we do want to make sure this is done right, so if it requires another meeting, we will be happy to do that. So the report includes the regulations that everybody's, I'm sure, read up on, the 500 or 600 pages of regulations that are available. And that is only the one regulation for the exchange. It doesn't include the other 4 or 5 that have been promulgated as well. The recommendations approved by the committee and approved by the board include the outreach strategy, and then the methods, the types of consumer services that can aid enrollment. This particular report, after we get through talking about producers and navigators, also has a consumer assistance inventory, rather lengthy discussion of what types of services are out there to potentially be navigators or assist enrollment, even if they're not necessarily called navigators. And with that, I'll be happy to take any questions on agenda item number 4.
Are there any questions about agenda item number 4 from the committee? With that, we will move on to agenda item 6, and we will come back to agenda item 5. Mr. Hager?
For the record, John Hager. So the committee should have received, either last night or early this morning, a summary that included information about producers, navigators, and this new category we call assisters. You might imagine we get a lot of comment once we put an item out on the streets. People decide that at that point they want to provide us all of the comments, much like was done today. So in consultation with the Division of Insurance, we came up with a couple of clarifications. The main decision that this committee faces today is what is the role of navigator. There's another decision, and that is should producers be part of this experience we call the exchange, because as many of you know at this point, the role of producers in the exchange is not mandatory, it's optional, but the role of navigators in the exchange is mandatory. Now you'll also note that staff's recommendation is that brokers be part of this experience, because we do think that brokers provide a valuable service, that brokers be allowed to provide, to sell, or to help facilitate the enrollment of individuals in health plans in the exchange. However you want to say that, we think that brokers should be a part of that. The real question we have is, though, what does a navigator do? In consultation with the Division of Insurance, we've determined that if a navigator actually enrolls individuals in coverage in the exchange, that they need to be licensed as a broker is licensed. It may not be exactly the same, but it would be similar, a licensing process that would be run by the Division of Insurance so that the consumer has protections. So if the committee today decides that navigators should enroll individuals in the exchange, then they need to be licensed. If that's the case, staff would appreciate having a third group of people, and we call these individuals assisters, that do nothing but education and outreach. And we also recognize that brokers do education, do outreach, but we're looking at a larger scale presentations to groups, areas that don't necessarily have access, readily available access to brokers, tribal communities, minority communities, places where we simply can't get to right now. So the role of the assister would be to provide that education and outreach. And basically, it's a presentation. They would not provide specific information on specific plans. They provide the overall idea of why is it important to provide insurance, why is it necessary to go to the exchange, what's the advanced premium tax credit, what are the benefits to going to the exchange. There would be presentations on this is how you would step through the web portal on a presentation approved by the exchange, but it would not talk about these are the specific decisions that you're going to make. It wouldn't say, all right, you want to take plan A because of this or plan B because of this. So we need somebody that can do that, and whether that's the navigator who is unlicensed and does not do enrollment, simply facilitates it by transferring that to somebody else, by transferring that person to somebody else, or whether it's a new category we call it assisters, we need somebody that can do that outreach component. So the question goes back to, is the navigator going to enroll people in coverage on the exchange? Again, if they are, they need to be licensed, and we need to have another category that of people. And the reason why we want this separate category is we don't want to have to force this group of people to go through a whole certification licensing process. They'll need to be trained and certified by the exchange, but not to the degree that a broker is trained and licensed. So the idea is we can get that outreach going without specific licensing and without specific information coming from them about specific parts of health plans. If we decide that navigators, and let me back up, navigators will be able to do that function as well, but then where that presentation stops and a person starts enrolling somebody, that's where we've got the decision to make. So if we decide that navigators should not enroll people in qualified health plans on the exchange, they would not need to be licensed, simply certified by the exchange through some training process so they can get the word out. They would do the function of education and outreach, and when it got to enrollment, the part about facilitate enrollment, which is a requirement of the Affordable Care Act, when they are required to facilitate enrollment, that would be a matter of transferring them to a broker, transferring them to the call center, or referring them to the web. So that is the main decision today. Again, the other decision is whether to allow brokers to play in this market or not. And I recognize that everybody's concerned about that as well. But again, staff's recommendation is that we do that. So that's the reason why the late notice last night, early this morning, this new document called the Sisters. I think it summarizes the basic functions of these three groups. Again, all of that hinges on, does a navigator enroll people in coverage? Some of the background that we need to make sure that everybody's aware of. The navigator definition is straight from the Affordable Care Act and the regulations. And there's no way around that. We have to have navigators, and they have to do those functions. The definition of a broker, producer, somebody that facilitates enrollment and is licensed by the state of Nevada to do so. The other thing that we need to point out, we've met several times with brokers. We've met with navigators. We actually sent Mr. Bowden down to Las Vegas to meet with brokers, and we met with brokers up here. We've also met with the navigators of the SHIP program. One of the clarifying items for the SHIP program is that individuals on the SHIP program were told actually enroll people in Medicare D and Medicare Advantage programs. Those are Medicare C and Medicare D programs, but those programs are not regulated by the state of Nevada. The qualified health plans that will be sold through the exchange are regulated by the state of Nevada, and that's the reason why we have to do licensing for navigators. So if they enroll people, they have to be licensed. And then the last item, and we've done a lot of outreach. The last item is the discussion about who can be compensated. The regulation is very specific that if you receive any consideration, direct or indirect, from a carrier, you cannot be a navigator. And providers, unfortunately, are paid. Well, unfortunately, they're paid by the carriers. So it's our interpretation, understanding, and our understanding with our discussions with the Center for Consumer Information and Insurance Oversight that providers cannot be navigators. That does not preclude them from assisting people in enrolling in coverage on the exchange, but they can't be navigators and receive navigator grants for that function. And then, I'm sorry, this is really the last item. The web portal, we are trying to make it obviously as user-friendly as possible to provide the best apples-to-apples comparisons between plans. We realize that we can't do all of it on a website, and we appreciate the assistance of both brokers and navigators. But some of the things that we are including in the website include formularies for the various plans, so you can see that the drugs that you take are covered by the plan that you intend that you're considering. Please put your phones on mute. It includes a list of providers, so you can ensure that your provider is on the plan that you are choosing. It also includes a cost calculator. Now, it's a very basic cost calculator. You go to the doctor several times a year. You have a surgery coming up. how much will the out-of-pocket be. So all of these tools are meant to assist the individual in coming up with a good choice for them. And we can't make it perfect. There is a risk judgment that the individuals will have to make about a catastrophic event, and certainly it will often take somebody helping them make understand that item. So in any event, that actually is the broad summary. I'm going to turn it over now to Mr. Bowden, who's going to talk about navigators first and then producers. Go ahead and go through it.
For the record, this is CJ Bowden. Navigators, we have navigators envisioned in the exchange to be groups, entities that are either public or private, and that will have individuals in that entity. Each exchange must have navigator program. Mr. Hager's gone over the definitions and reasons why the navigator program is there and what the drawbacks are to being a navigator. If you're a broker, you cannot receive compensation through a carrier, etc. The navigator groups will educate and enroll consumers in qualified health plans with publicly funded health care through multiple enrollment methods provided by the exchange. Navigators and producers will work in concert to ensure that all Nevadans have access to health care coverage provided by the ACA. The types of entities that are stated to be in the navigator function would be trade, industry, and professional associations, commercial fishing industry associations, ranching and farming organizations, chambers of commerce, unions, resource partners of the Small Business Administration, licensed agents and brokers. Again, if they're a navigator, they cannot receive compensation from a carrier, so they have to give up all ties to carrier-based compensation. And other public or private entities or individuals that may include but are not limited to Native American tribes, tribal organizations, urban Indian organizations, and state, local human service agencies.
I'm just going to interject there for the record, John Hager. Again, the distinction between a navigator and a broker. If a broker wants to be a navigator, they cannot receive any compensation from carriers. It does not mean that you have to be a navigator to sell products as a broker on the exchange. We just want to make sure that that's clear. If you decide to give up your compensation from carriers, then you can be a navigator if you want to take that risk. Okay, but you can still make a living selling products outside the exchange and inside the exchange as a broker, assuming the committee agrees that brokers should sell products on the exchange. They would not be navigators. Brokers would not be considered navigators in that case. So just want to make sure that's clear.
And with that, navigators, for the record, CJ Bowden, navigators must not be health insurance issuer, a subsidy of a health insurance issuer, an association that includes members of, lobbies on behalf of the insurance industry, or an entity or individual that receives any compensation directly or indirectly from any health insurance issuer in connection with the enrollment of any individual or employees in a qualified health plan or non-qualified health plan. So, roles and responsibilities of navigators. Navigators will be responsible for outreach, education, and enrollment, as envisioned where we're at right now, for the currently uninsured or underinsured populations and will present these populations with the options available to them under the ACA. They will give information not limited to, but including program eligibility, methods of purchase, reasons to purchase health insurance, definitions of health insurance terms, dispute resolution. They'll provide cultural diversity and linguistic compatibility with people, including Hispanics, Asians, American Indians, and other groups. Group outreach opportunities, access to enrollment locations from the navigator standpoint, answers to enrollment questions. They'll explain eligibility criteria for the different programs offered on the exchange and publicly funded insurance programs, and they'll provide documentation to the person when they've enrolled. They'll also, as stated in the ACA, furnish unbiased explanations of coverage, and that'll be restricted to what's available on the web portal. They can't opine or give opinions of which plan is more important or a better choice than the other plan. If navigators are to enroll people in the exchange, navigators will require certification and licensing by the Division of Insurance. The Division of Insurance will put together a program and licensing specification. The Division of Insurance will issue the testing and the instruction on that. The training, certification, and licensing of navigators will be paid for by the exchange. However, entities wishing to certify their employees or associated volunteers as navigators must pay the exchange in advance for the cost of training, certification, and licensing. The entity will be reimbursed by the exchange upon certification. To become certified, the navigators will be required to attend training provided by the exchange. The training will consist of a 3 to 4 day, 24-hour training course that covers the coverage that's available under the ACA, approximately 2 hours, qualified health plans, which has actuarial values, coinsurance, copays, and deductibles, approximately 4 hours, exchange eligibility requirements, 4 hours, advanced premium tax credits and cost sharing reductions, 2 hours, publicly funded health care, CHIP, Medicaid, 3 hours, means of appeal and dispute resolution, 2 hours, conflict of interest and impartiality, 1 hour, exchange privacy policies and requirements, 2 hours, use of the web portal, 2 hours, and testing, approximately 2 hours. At the end, they will be administered a test. A passing score is 80% or better. Navigators will be required to recertify each year. It will consist of 2 days, 16 hours of update training. The update training will consist of topics covered in the initial training period and updates on any new or changed regulations. Navigators must attend these trainings and complete the annual recertification tests to maintain their active navigator status and funding source. U.S. Department of Health and Services indicates that it will release model navigator training standards. We will look at those when those are released. Navigator compensation. Navigators must meet certain criteria before they will be considered for a navigator grant. They will be required to submit an application to the exchange, and this application will include their ability to demonstrate to the exchange that the entity has an existing relationship or could readily establish relationships with employers, employees, consumers, including uninsured or underinsured consumers or self-employed individuals likely to be eligible for enrollment in a qualified health plan. Demonstrate willingness to meet any licensing, certification, and other standards prescribed by the state or the exchange. Include contract language that indicates the entity will not have a conflict of interest during its term as a navigator, and if a conflict of interest does occur, the navigator may be required to pay back navigator grant funding to the exchange. Demonstrate the entity has possesses in place, Demonstrate the entity has processes in place to comply with the privacy and security standards adopted by this exchange, and demonstrate how the organization's business model, service area, and clientele will be leveraged to support the navigator mission, and show how navigator functions will support the navigator mission and ancillary functions of the entity. All of this is directly from code. Currently, the navigator budget for the exchange is listed at $285,000 in 2013. Each year thereafter, it's listed at $380,000 in grant funding. Those grants will be distributed by competitive grant. After their grant application is approved, they will go through training and certification by the Department of Insurance or Division of Insurance, and then it will come back to the exchange for distribution of funds. Navigator and conflict of interest standards. Everything is set forth in the Act. Navigators can't have financial consideration with a carrier in any way, shape, or form. Their HHS will dictate further model conflict of interest standards, and those will be incorporated into all of the navigator functions that we have. For performance metrics, the exchange will monitor available enrollment metrics so that the exchange can provide reasonable future improvements to the system. Upon certification, navigators will be assigned a navigator ID number. The navigators will enter this into the web portal when assisting consumers with enrollment. This code will help staff to review enrollment trends and monitor post-enrollment surveys. Enrollment trends can be analyzed to determine if certain navigators are steering business in a manner that is statistically significant when compared to other navigators. Post-transaction surveys will be available to the consumer so that they may provide feedback on the purchasing experience.
Madam Chair, did you want us to stop there or continue through brokers?
I think I'd like to stop there and start some discussion here on navigators.
And, ma'am, if I might add then one additional kind of a summary. I'd ask the committee not to get too hung up in the details of the training, the licensing. The big question, again, is will navigators enroll people in the exchange or not? The requirement to be licensed after discussions, significant discussions with the Division of Insurance, it appears that they have to be licensed if they enroll. So again, the question is, do navigators enroll people or do they simply facilitate enrollment by referring to brokers, the web, or the call center?
I think that makes sense. Thank you. So with that in mind, committee members? Mr. Mazzoni.
Dwight Mazzoni for the record. I'm not sure, Mr. Hager, whether I should compliment you on the sleight of hand or not, but I think we just went from enrolling navigators to assisters. I guess that's okay because there's been some research about what that's all about. We seem to be walking a very fine line here right now of a navigator versus a producer. And if I understand your question, you're looking for some sort of a motion that says navigators enroll yes, navigators enroll no. Is that correct?
Yes.
By enrolling, what does that, can you further define that? I know I had discussion with Mr. Bowden about this, but can you further define that, or is that something we should not discuss at this time?
Okay. Yes. What you mean by enrollment should certainly be discussed because that would actually go to the heart of whether they should enroll or not enroll. And so I guess it's not just a question of yes or no, but where is the line drawn between enrollment and simply outreach and education? So we are looking to the committee to provide their recommendation on where that line should be drawn. There has been comment in the past that could a navigator simply help a person fill out a form? And so in this case, the form is the website, and they're simply helping them put in the right information at the right place. I don't know if it means if that's what enrollment is. I don't know if it's providing advice on what plans to take. And I'm looking to the committee and the public to provide us with a recommendation on where that line is so that we can move forward with a good product.
As someone who's done this for quite a number of years, it would appear that if we actually built a web presence, a site to go to, and I'm assuming that somehow, some way, all the community organizations are going to have the capability of having access to a website via laptop or desktop or whatever, that a navigator, in my mind at this point, could lead people up to the laptop, could lead people up to a piece of paper, or they could direct them to the right door, since one of the presumptions that we have here is that there's no closed door for somebody who needs coverage, whether it be Medicare, Medicaid, whether it be a CHIP program, and whatever the programs are that are out there. And that's at the point at which the navigator, in my understanding from all the things I'm looking at, that's where the navigator stops, because now the navigator, the next step is you're actually enrolling somebody in a program somehow, some way, some shape. If I have an employee in my office as an insurance producer, and that employee will sit down and fills out the application with the client, maybe makes recommendations, I better make sure that that employee is licensed under the state law. At least that's my understanding from the Department of Insurance at this point. So when you talk about responsibilities being education, outreach, and then you go and enrollment, I question, what do you really mean by enrollment? If enrollment is saying, here's a laptop, go ahead and have your fun playing at which one you want to take, then I think maybe that's where Navigator is okay. But the minute they cross that line and doing some of the things that you all have mentioned doing, which is advising the client, this is the better plan, or whatever, now they've crossed a line where now, I don't care what you call them, navigators or producers, now they better be licensed by the state of Nevada. And it seems pretty simple to me that somehow we have to get it down to that level and follow course with that.
And Lynn Atkins for the record, and I think that is what the Division of Insurance's point is that if the navigators, if we decide as a committee and then the board approves that navigators are going to be enrolling people in health programs, in insurance companies, then yes, they are going to need to be licensed. So I think that, so assuming that is how it's going to be, the question is, are navigators going to be enrolling people and not be paid commission? They'll be paid through the Navigator program. I want to make one comment about that, and then I want to hear from other committee members. I'm concerned that if we don't allow them to enroll people, that all of the outreach we're talking about, all of the other communities, the multicultural, the multilingual, the rural communities, when the navigators and assisters go to those communities to do outreach, I am concerned that they go there and then they say, go to the website or call, or they can't help any further. And I think that's a misstep. And I think since the goal is to get as many people covered, that once we spend all this time and energy doing all of this outreach, that if we can't take the next step and get them enrolled, I personally think that's a misstep, and I think there's going to probably be, if we go that route, there's going to be some crossover. But the brokers and the agents who are doing what they do and have been doing it for years are going to continue to be able to do what they do and get paid the way they get paid. This is, I think it's ultimately going to be for the other communities that have really been the underinsured communities that kind of need the navigators to actually enroll them. Mr. Downey?
Thank you, Madam Chair. Randall Downey for the record. I want to second your remarks. They were well said. I think there's an attempt here, unconsciously perhaps, to mystify what a broker does and or a navigator might do. I'm not certain that the committee has a clear understanding of actually how navigators operate, and I would, on the record, ask them to, if they have the time, to contact the nearest thing we have currently to an exchange operation in the state of Nevada, which is the State Health Insurance Assistance Program. Tell them you'd like to sit down with one of their navigators and watch how they function, and that will clarify, I believe, for the committee members and members of the board exactly what navigators do in the state of Nevada. Not only will you hear them in contact with clients, but you will actually see them operate through a web portal, and I think this will demystify to a large extent what navigators may or may not be able to accomplish. I understand, and I was somewhat concerned about the licensing of navigators by the Division of Insurance, but I appreciate your remarks, Director Hager. That clarified that in my mind, and I'm in full accord in that position. The navigators should have the, and again, this seconds Chairwoman Atkins' remarks, that navigators should have the ability to enroll. And I think this whole question was put well by one of the gentlemen who made public comment this morning, that they do not sell a product. We help people choose the best coverage for themselves. And with Medicare, for example, using the web portal and giving unbiased information concerning the plans and coverage available to a client, such is done. And enrollment is the choice of the client, of the beneficiary, not of the navigator. I will have probably further remarks. Thank you.
Thank you, Ms. Ellis. Whoever is on the phone, if you can please mute it. Ms. Ellis?
TV Ellis for the record. I want to thank the staff for the work that they have done in really sorting through this information and putting it in a way that is better understood. But I really appreciate the final document that they sent, the summary that introduces a well-defined, summarized definition of producers, navigators, and assisters. And as the only minority Latino in this process, I will encourage our committee, and I will put a motion forth, if possible, to approve these 3 definitions as recommended by the staff with their corresponding training and licensure by the oversight corresponding agencies, having the navigators and the producers licensed and trained by DOI, and having the assisters trained and certified by the exchange, and then assuring that their compensation is followed through as recommended by the staff also. I think it's important not only to recognize the work of the producers thus far in the healthcare insurance industry, but we need to admit the fact that this is new for everybody. It's new for our nation, it's new for our population, and it's new for everybody and the 500,000 Nevadans that have no insurance. So with that in mind, having more players and everybody playing a role according to their area of expertise, whether they have it currently or they will acquire them in the future, I think we need to keep in mind what the purpose of all these is to provide the ability to the 500,000 Nevadans that have no insurance to have access to insurance in a way that is appropriate for them. So my motion is to approve the recommendations by the staff of the recommendations of having the producers do play in a role in the insurance exchange as enrollers, having the navigators being enrollers in the insurance exchange in addition to education and outreach, and having the 3rd category of assisters to provide limited or only education and outreach to the community at large.
Thank you.
Do we have a motion on the floor?
Is there a second to the motion, and then we'll do comment?
I'll second the motion.
Thank you, Mr. Downey. We haven't had a chance yet. Thank you very much for the motion and the second. We haven't had a chance for all the committee members to weigh in prior to that. So at this time, Ms. Joyner, Mr. McCoy, Ms. Perriardi-Boothman.
Thank you. This is Amber Joyner. I actually do have some comments. I'm glad the question was asked about the definition of enrollment, because that was my main question. I'm concerned, although I appreciate how this has been laid out, I'm really concerned that if the navigators are licensed through the Department of Insurance, and the language looks like it says similar to how agents or brokers are, that we won't have enough navigators. And my understanding of enrollment is different, I think, from what the discussion that's been happening. I absolutely agree that these navigators need to be able to walk somebody through the form or the online process. I look at a navigator as an educated friend or an educated family member who is concerned about this person and wants to help them through the process. From past committee meetings, what I remember the discussion being is that this navigator could help walk the person through the process, but at the point at which the individual seeking insurance needed help deciding which insurance product they wanted, they would immediately be referred to an agent or a broker. My definition of enrollment is when you hit the send button. And the reason for that would be that then the navigator could walk the person up to the point of commitment and up to the choice. So they could help them fill out all the different forms, they could help them read the pages of the different deductibles. Here are the 3 health insurance plans that are in your area that have your doctor in them, everything up until the point of commitment. At that point, my understanding is that since this is a web-based thing that most individuals will be able to apply to anyway themselves, the person signing up for insurance, signing up for the exchange, will be the one to hit the button and say, I'm now enrolled. And there should be a disclaimer. There should be an electronic signature that says, I've made this choice independently. No one is, hitting this button for me. So my concern is that if we make the navigator so much like a broker and an agent that they have to go through the Department of Insurance to be licensed, we won't get enough of them. On the other hand, I do think they should be able to walk up to the point of clicking the button and committing.
Thank you. And could I ask just for some dialogue back and forth, what would your thoughts be then, Ms. Joyner, about like a rural outreach program or so? If whoever was the navigators went to a rural community and gave a presentation, gave the information, and got them up to that point, then what? I mean,
well, I think even in the rural communities with 4G out there, that we would have the ability to have a laptop available. They could walk the person through it, and then that individual at the meeting could be the one to hit the enroll button for themselves. I don't think the navigator should be the one hitting the enroll button because, as we've discussed, they would need insurance, they would need all kinds of liability issues. But even in the rural areas, I think technology is up to the point where they could be walked up to that point of the choice, and the choice is theirs, and they are the ones making the electronic signature that they are enrolling themselves.
Thank you. Mr. McCoy, do you have any comment at this time?
Yes, I do. And I think if I might kind of reach back, which goes back quite a few decades, my education, a particular course I took involving a gentleman who became Senator Hayakawa, it's a question of semantics. And we're dealing with some semantical problems here. As Ms. Joyner referenced to the enrollment process, I think that the brokers, I guess we call them producers, that's just another semantical thing. I think that brokers and agents need to recognize that this is a new way of doing business. The portal is the end product of either the broker working with this process or the navigator. And I think that Amber is on to something. I don't like to use the term selling because this is not, from my perspective, this is not what the navigator is involved in. The navigator is assisting, bringing him to that point, and I think Amber makes an excellent suggestion on how this would finally reach the point of action by the individual. One of the things that I think that this committee needs to recognize, as well as the entire health insurance exchange, is that we don't know the numbers. You know, you can read material from the health exchange staff, you could read material from the governor's office, you could read material from Senator Reed's office, Heller, whomever it might be, and the numbers are all over the place. And we don't know what we're going to do with Medicaid expansion at this point. So there's some uncertainty into the number that we're going to need. But there are certain realities that I think we do have to address. And one of those is the rural sections of Nevada. So one of my concerns about navigators is I think we have to be sure that we have a sufficient source of navigation, if you will, that will be available in the vast majority of our landmass in Nevada to take care of those. And quite honestly, many of those are those that are uninsured at this point, or underinsured. But just to kind of wrap up, I think that one of the comments I want to make, I serve as a volunteer for an organization called the Patient Advocates Foundation. I'm Nevada's representative on the President's Council for that organization. And they do a study each year of every state based on the number of complaints about insurance, or maybe a concern about insurance, or maybe a billing issue, or whatever. So this is not Medicare. It is to Medicare to some extent. It's not Medicaid. It's to some extent Medicare. Nevada had 42,000 inquiries with case management people associated with the Patient Advocates Foundation. 1% had to be moved up beyond resolution. State of Texas, almost 10%. State of Florida, 10%. So I think that from a standpoint of commendation to our industry in the state, we have a pretty solid group of people who are engaged in selling as brokers and agents the health products that we're talking about. So I don't want to suggest otherwise, but I do want to say that the purpose of the Affordable Care Act from day one was to engage navigators. And it was only at the tail end that they said, okay, we'll let brokers and insurance people be involved. That was not a certainty at the outset. And because of that, I think that the purpose from my vision, if you will, from a health-associated organization that I work for, is that the navigation is a critical part of making the Affordable Care Act mean something in the final analysis. I think we need to have the enrollment process. how we license, some of the things that we're going to talk about subsequently certainly are important. But I think that we need to take into consideration the purpose of the navigator, the purpose of the producers. They're not in conflict at all. I don't see it that way. There are some people that will not be comfortable working with an insurance broker. No reflection. That's just the reality and history. 5 years from now, that may be different. But right now, I think it's important to take into consideration the population that we're dealing with. Navigation is a means of getting more people enrolled than we can with the alternative method of insurance brokers alone. I do want to make one comment, however. I do have a problem with the staff's recommendation. I've raised this before, and I'll raise it again. There has to be a method by which an individual who has a chronic disease, or anticipating because of family history of chronic disease, that they can get some advice on plans. It is ludicrous to suggest that nobody can suggest to them, once we have an EHB, which we don't have, and a qualified health plan, that the qualified health plan is going to have enough visits that's going to take care of that particular person's chronic diseases. We're not there yet. And I am very concerned that that aspect will be ignored in this process. So I'll leave it at that.
Thank you very much. And I agree with your comments about navigators, and I also agree. I think one of the concerns I have that both you and Ms. Joyner brought up are if the certification requirements are the exact same for navigators as brokers, that I do think there's going to be a very few people who are going to join the navigator program. So I think there's that issue, and I think the board also is going to need to look at the funding available for navigators and how we figure that out. Ms. Parati-Boothman.
Thank you, Mr. Chairman. Gina Parati-Boothman for the record. A couple of comments as I listen to statements made and consider the documents that I've reviewed. First of all, I concur with several of the statements that have been made regarding a reevaluation of the funding. The presentation that was provided with regards to the start or annual budget, and then the preceding years after that. I think it might be helpful, if it's acceptable, to include that in the documentation, because currently there's just on page 9 of 9 on the document that was reviewed, there's just currently the exchange has budgeted for navigator grants. It'd be nice to see a little bit more clear breakout of that. With regards to what the staff has done on the document draft, producers and navigators, where it defines the three entities, where you have producers, navigators, and assisters. When I think about the Affordable Care Act, the foundational regulatory statements with regards to what needs to be included in a programming of this magnitude, the fact that our definitions for navigators, if you will, comes directly from those regulatory statements. And I consider the penumbra as this type of programming is phased out, and personally having had experience, these assisters are going to provide a great segue into education, if you will, information provision, networking, outreach. And then at that point in time, I would agree that a slight reevaluation of the expectation of certification training from the DOI for our navigators, which is important, and somebody has to start somewhere. Earlier a comment was made that individuals had been broker agents for years. Well, I've been in my profession for over 30 years, but there's got to be a point where somebody starts somewhere, and I would like to have the hope and faith, if you will, that we have programming and education and training, of which I believe at some point these navigators to a certain level must understand what information they're providing. And maybe we can look at time considerations so the magnitude and expectation of this education and training provides a strong foundation initially, while not overburdening or preventing individuals from entering into this type of support as a navigator. Again, I appreciate the work on that. Then by the time you get through the training, as I envision this, you're at a point where you can further segue into what I believe is a very valuable component from our producers, which are, i.e. brokers or agents. They provide a great deal of information. One other comment is that with regards to the table, there's one of our other documents that's been provided, item number 6, I believe, the Consumer Assistance Advisory agenda item. In page 2 of 3, there's a summary, but it also provides this table again, and excuse me for harping on the tables, but I love them because it makes everything quite explainable and easy to navigate all of the information. Is it possible in some way to, as we move forward, add the assistance or assisters category? And then I also believe that and we were discussing earlier as committee members, on page 3 of that document, there's a segment that states provide unbiased explanation of coverage provided on the web portal, etc. And that is only marked under the navigators. I would like to hope to think that our expectation is that unbiased information, education, networking, whatever that may be, is expected by all participants or individuals. Thank you.
Thank you. Other committee members? Mr. Downey.
Thank you, Madam Chair. I'd like to follow up and amplify my current remarks. I'm thankful to Ms. Joyner and Mr. McCoy. I too would agree that if we're attempting to license navigators to the same extent as currently exists for producers/brokers, that would discourage individuals or nonprofit entities from stepping forward to enter the Navigator program. So I think that needs to be given some further consideration. Point 2 is that I would agree as well that the current budgeting for the Navigator program is entirely unrealistic. It's way too low in terms of compensation for the Navigator program. I think if we do the simple math, or begin to do the simple math regarding the daunting task that we're looking at both through the call center, through the producers/brokers, and the Navigator program, I think one of the commentators earlier mentioned that when dealing with a client, it takes a minimum of an hour. We're looking at 550,000 individuals who currently do not enjoy health care coverage. If we assume a third of those will be going on to Medicaid and can be assisted through that program, we're still left with several 100,000 individuals. That's going to take a lot of man-hour time, and we cannot do anything that's going to discourage an expansion of either the broker/producer and or the Navigator assistance we are being able to provide to the citizens of Nevada. Again, I want to also appreciate Ms. Joyner's remarks regarding what actually happens when you press that send button and who bears responsibility for that. I think that point was well made. And with that, thank you very much.
Ms. Ellis.
I want to add to the recommendation of including in that chart the assisters, but also on the original document called Producers and Navigators Draft, which is, it has about 9 pages. If we could also on the content include the assisters with their more expanded definition of roles, licensing, compensation, and performance metrics, I would appreciate that. Thank you.
Madam Chair.
Yes.
I wanted to point out one thing before we get too far down this road. The licensing for navigators, it was the intent of the Exchange and the Division of Insurance to create a license that allows them to enroll individuals. It's not going to necessarily be exactly the same as brokers, because brokers can sell other products. Outside the exchange supplemental products, it would only be about qualified health plans and the advanced premium tax credits. So we do at some point need to get through the producer piece. Some of the changes that we've made to that, we expect that, again, our recommendation is to allow producers to sell products in the exchange, that the training and certification to sell products in the exchange be combined with the current process. So to be a producer to sell products, to sell health plans, that training and certification licensing would also include selling on the exchange. So all the new producers out there that would be licensed from some point forward would all be eligible to provide coverage in the exchange as long as they sign the agreement, the conflict of interest agreement, or the agreements that are required. For current brokers, we would have to work this into continuing education, but the intent is that all producers be allowed to sell insurance on the exchange. There was concern about, well, you're just letting anybody do it. Well, no, that's not the case. They still have to be licensed producers. So I wanted to get that point through, and then the other part, again, the navigators. If the recommendation of the committee is to enroll, that they be licensed, but not to the same extent that brokers are. We would do everything that we need to do to make sure that the consumer is protected, but we don't think that it needs to be as intensive. It needs to certainly be thorough, but not quite as intensive as the current producer licensing process. With that, I have another meeting to get to. I apologize for getting out of here early.
No, that's okay, Mr. Hager. We just, at the moment, we have a motion and a second on the table that I kind of have to deal with and can't kind of get to another topic until we deal with that. So thank you. Are there any other comments from the committee members?
Madam Chair, I did have...
Yes.
Thank you. I did have 2 quick comments on... I would hope that in this motion that we could consider some of the comments that have been made regarding the language being used currently in our recommendations. In regards to Mr. McCoy's comment about some of his patients, for example, needing advice on certain things, I appreciate in one of our public comment handouts using the word providing information and services in a fair, accurate, and impartial manner. I think that we should be using that language rather than the word opinion. It may be that Mr. McCoy's navigators have opinions about what would be best for their patient, but they provide it in a fair manner. So if we could be consistent in using that federal language, I think that would be helpful in all of our discussions. And the other concern that I had relates to providers, and this would be on page 6 of one of our documents, the procedures and navigators draft. On page 6, and I believe this was also pointed out during public comment, an entity, it's the list of what navigators must not be, and in it it says this requirement excludes providers, hospitals, and doctors and producers from becoming navigators if they continue to receive funds from carriers. And I think I heard a few minutes ago that it wasn't our intent to preclude a federally qualified health center or some other entity within a hospital to help people sign up. So I think that language needs to be clarified, not to say to continue to receive funds from carriers, because clearly they do receive funds from carriers through insurance, but that somehow be revised to make it very clear that we're not saying that a hospital or a facility can't have somebody on staff to help in this process.
Thank you. At this, I think it sounds like everybody's kind of the general opinion that we're somewhere near a conclusion, but there's lots of edits that we'd like. So I think what might be easier is to take a vote on this, and if we don't pass the motion, then we kind of can take care of these edits and then have another motions, because we can't have anything withdrawn or anything. So
Madam Chair.
With that, yes?
And I apologize. So just a clarification, from my understanding of the motion, it was to include the entire package, not only that navigators enroll and be licensed, but also that producers be allowed. I believe the motion from Ms. Ellis was that producers be allowed to enroll people in the exchange. So it appeared that her recommendation was or a motion was to approve the entire package. And then the other thing I wanted to remind you is we said that we would provide public comment before the vote.
Oh, yes, I know. We're discussing that up here right now, which is we're kind of got ahead of ourselves, I think, a little bit. So it sounds to me like we kind of need to start over. With that, I will see if there's any public comment prior to us taking a vote on this, and then we'll continue the discussion. Is there any public comment in Carson City?
Yes, there is.
Hi, I'm Peter Breen, independent agent. I just wanted to point out I have, and many of my colleagues, all of my colleagues have actually sat in front of individuals or groups of individuals looking to quote unquote enroll into a health plan. And it is in the real world, when you're enrolling somebody, you are actually including advising somebody, helping them decide what plan would work best for them. It is virtually very unrealistic to expect somebody to act as an enroller, so to speak, without providing advice. I've sat in front of groups of individuals in an employer situation where 2 or 3 different plan options are available to the employees, and we've maybe gone to an open enrollment meeting, explained and outlined briefly the 3 plan choices or 2 plan choices, and say now it's time to enroll, and pass out the enrollment packets, and lines of employees will form in front of us saying, well, what plan do you think would be best for me? And so here they are with their enrollment material and they're asking for advice. So the two really do go hand in hand. When an individual comes to our office and they're ready to enroll into a plan, well, what plan do you think would be best for me? Based on my particular, because everybody has individual needs and circumstances. Some people have families, some people don't. Some people have different, people have different levels of incomes, and so they're really looking when they go to enroll, they're looking for guidance. Yes, you will have people that they know what plan they want. They've done their own research and they are ready to enroll. They can do it online or what have you, but that is, in reality, a very small segment of the population. Thank you.
Las Vegas.
Again, for the record, my name is Peggy Mays Johnson. I have never been in the position of a broker or an insurance salesperson. I have, however, over my many, many years, bought lots of insurance. Health insurance and life insurance and house insurance and car insurance. And if somebody advised me, I would feel like I was being sold, and I'm a person that doesn't like to be sold. If people give me options, I would say that is the role of a navigator, is to say these are your options. And I think that anybody doing anything other than that is stepping over the line. And I agree with Ms. Joyner when she said there should be a form that says, this is my own free will that I am choosing. When I go in and buy insurance, the minute I sign my name, I am pressing the button. Or if I'm doing it online, which I have, the minute I said I do send, I'm pressing the button. So I agree that it is up to the individual to choose what they want. And I think that any navigator that is giving advice is stepping over that line. They can offer options and no more than that. I would not go to an insurance agent that did not offer me options. And I think that I'm intelligent enough to make my own choices. And if I've made a mistake, I've made a mistake. So if I were training navigators for my program, anybody that gave assistance by advising would not be doing it the next day. Thank you very much.
Thank you. Carson City.
Thank you. Again, my name is Patricia Porter. I'm an independent agent. And it is my experience that enrolling is a process. It is a process. It's a complex process. It's not about pushing a button. It is about starting with education. The next step could be selection. And in that selection is considering the specific situation of the individual requesting assistance. The next step could be filling out forms, which is the least important step of the process, in my opinion. And the last one is submission, is pushing that button. In this process, education is the most important piece. It is about the person understanding what plan they are enrolling to, making sure that they know how to take advantage of the benefits offered by that plan, and that they feel happy using their benefits, knowing their doctors are in network, what hospitals they can go to, can they travel with it, what lifestyle they have, and if the plan is going with them. So, in my opinion, navigators should be simply educators, where they say, you know what, we have health savings accounts, which means this, and you have these options. This is a deductible, this is coinsurance. And when it comes to say what is best for me, then you need to speak with an agent, in my opinion. And in my opinion, again, they should not enroll, because enrollment again is not that button only. Enrollment is the last piece of that. It is first about education. So the way I look at navigators is educators. And I agree also to the statement that we should not be looking at this as a conflict. I think navigators and agents could very well work as a team in that educational process. To me, as a person that works also with a Hispanic market, I can really tell you that it could sometimes take more than 1 hour helping people that don't even speak English, and they need other type of assistance in this process of enrollment. So, no, they should not enroll, in my opinion. Thank you.
Thank you very much. Las Vegas.
For the record, Dan Heffley, again, independent agent. Two things came to the fore in listening to the committee discuss this. The first was Mr. Hager's statement that the licensure is required by law if there is enrollment. He had also stated that the licensing would not be as intensive. So I would ask the committee, are we really advocating for less consumer protections? Because that's what licensure is for. The second thing is to Mr. Downey's remarks regarding the compensation for too low at $250,000. I believe he mentioned the number of man hours that would be required for this. I would like to remind the committee that producers are paid for performance, and as such, they don't affect the budget. And lastly, in response to Ms. Peggy's public comments, with the exception of captive agents, offering options is what licensed producers do. Thank you.
Thank you. Carson City? Is there anyone else in Carson City that would like to comment?
Yes, there is. Pete Gilbert, insurance agent, broker. I have three people. I just have a small agency. I have a broker in my office or an agent that works with me, and then I have my other assistant that handles the phone. She is not a licensed agent, and then I have a licensed agent. And it's very important that the person that is not a licensed agent doesn't step over that line. They don't talk about rates. They don't talk about benefits. All of that comes through either me or the other agent in the office. And when you're enrolling somebody as a navigator, and then you turn around and then you help them, at some point in time, they're going to ask to find out more about, what do you think is a good option for me? I mean, that's what an agent does. And so it's a real fine line between what a navigator would do and a broker agent would do. So I just throw that out as comment. Thank you very much.
Thank you. Mr. Gold?
Thank you. For the record, Barry Gold, AARP Nevada, Director of Government Relations. I'd like to echo the comments that Amber Joyner made. I think the semantics are really interesting here. I think the idea of facilitating enrollment versus enrolling people. I think if you asked Wanda Brown, who's the director of the SHIP program, whether her volunteers enrolled people, whether it be in Part D or in Medicare supplement policies or Medicare itself, she would say, no, we do not enroll people. We facilitate their enrolling themselves. And I think that's an important distinction, and it's something that is already happening within the state, actually inside of a state agency. So there's precedent for that, for them to facilitate enrollment. So I just wanted to mention that, as well as the gentleman before talked about if indeed navigators are forced to be licensed, and if the licensure is less than the other, is that a consumer problem? Well, looking at the training and education efforts that are in the packet right there, it looks like a broker needs about 30 hours to start, or actually 28 hours of upfront training to get licensed, pass a test. We're asking for navigators to take 24 hours of training, so that's kind of the same. And then ongoing basis, it looks to me like producers or brokers would need about 14 hours a year, because it's 30 split out over 3 years, and then there's an additional 4 years per year, where navigators need 16 hours, so they need more per year. And the current thing means navigators have to take a test every year, but producers would not. So the current setup actually would provide more protection for the consumers from navigators and for producers. So I just wanted to kind of point that out. But I think the semantics are real important in terms of navigators. Do they facilitate enrollment, or do they actually enroll people? Thank you.
Thank you. Carson City.
Elisa Caffaretta again for the record. I just wanted to say how much we greatly appreciate the support that we are hearing on the subcommittee for the unique needs of the underserved populations and the recognition of some of the relationships that the human services and healthcare organizations have with these particular clients. We have a Promotores program which spends a great deal of time in the community, in conversation, and we can certainly envision that once you got through probably a very long conversation about education and healthcare, that we want to be sure that at that point when a person is ready to make a move, they be able to get into the system of the exchange or into a government service like Medicaid. So I think the biggest challenge to this committee is going to be we've had all kinds of testimony on, you know, whether it's licensing, whether it's enrollment, whether it's facilitation, and now you're going to be asked to take a vote on something where you're not actually looking at the language in front of you. I think that's going to be very challenging. Whatever we end up with at the end of the day, I certainly think that the chair's comments that we don't want to give people all this information, get them ready to take an action, and then step back away from them and not, facilitate as a friendly person their ability to take action and get into the system would really not serve us, and certainly would not achieve the goals that have been sent out by the Exchange Board. And I do want to really echo the comments that Tom made, particularly about people who have chronic services or situations, people that know they're at risk for certain diseases or issues in their health. We absolutely need to be able to, everyone needs to be able to provide the information. And again, the language in the Federal Register, I think, provides all the protection that everyone needs, which is navigators, and this is the federal law, would provide information and services in a fair, accurate, and impartial manner, and such information must acknowledge other health programs. Thanks.
Thank you very much. Las Vegas.
Greg Clemenson, Clemenson Insurance Services, and what I would like to do first, if I may, take liberty in stating the motion. I wrote it down, and I just want to make sure I'm clear on the motion that's on the floor. What I wrote down was that the navigators should be enrollers, and that they should be trained and licensed by the DOI, that there would be assisters that would be trained and certified by the exchange, but evidently would not be enrollers. And then there would be producers that would be enrollers, and they would also be licensed and trained by the insurance division. Have I got that about right?
It's just public comment at the moment. We're going to restate the motion before we vote.
Okay, very good. And one just point of order. I'm just wondering whether or not Mr. Hager's departure changed the whether or not there was a quorum or not.
Thank you very much.
And
any further?
Yes. One short thing, to be real quick here, and that reminder that under the Silver State Health Insurance Exchange Chapter 6, 95I, Section 520, nothing in this act and no action taken by the exchange pursuant to this act shall be construed to preempt or supersede the authority of the Commissioner to regulate the business of insurance within the state. Regarding licensure of insurance producers, NRS 683.201, a person shall not solicit, sell, or negotiate insurance in this state for any class of insurance unless that person is licensed for that class of insurance. A person is required to be licensed in this state who transacts insurance, and not having that license would be subject to an administrative fine of not more than $1,000 per violation. Thank you very much.
Thank you very much. Carson City?
Bradford Backlund. I'm an independent agent, also a member of the Association of Health Underwriters. And I just would like to echo the same comments as Ms. Porter. I agree 100%. I think navigators and broker, producer, agents, whatever word we want to use, can work synonymously. I think we can work side by side and help each other out. Obviously, with the addition of navigators, also maybe educators would definitely maybe help our role and lengthen or shorten our time is what we're spending with clients, an hour, 2-3 hours just trying to educate them before we even counsel or advise or whatever word we want to use. I think sometimes we get ourselves caught up in a vocabulary war. But I would say that when I'm sitting with across the table from my clients or prospects, that it's not a matter, I advise, I counsel, I ask questions. It's about risk assessment. It's about what can you potentially self-insure versus what do you want to use as a vehicle to insure the risks that you can't afford to self-insure or you want to pass off to the next guy. And those are the comments and those are the questions and statements or advice that I give to my clients. So how much can you self-insure? How much can you not? What do you want to do? And then from there we could discuss plan designs, options, things like that. And then from there, they're making the choice. It's not, hey, here, Mr. Insurer, here's my option, and you're forcing me to take that option. I think what the one young lady was alluding to in Vegas. I also would like to say that, we have all these programs, SCHIP, Medicaid, Medicare. Those that want to take advantage of them are taking advantage of them. And those that aren't. And I don't think coming out with having navigators go out to these communities or whatever is going to force those people to all of a sudden now want to buy insurance. It's the old adage, leading a horse to water, but you can't make them drink. We can put all the personnel, all the people, throw money to the wind and send those people out to these communities, rural communities, and there's still no 100% chance that they're going to buy insurance. We still are going to suffer the possibility of still having all these uninsured programs or uninsured people, and I allude to the program, the PSIP program. We thought that was going to be a great fix, and it's been nothing. So I say that, and I also want to say that if navigators are to sell and enroll in Medicaid or in qualified medical plans, they should be held to the same standards that I, as a broker, am held to. When I apply for an appointment with Anthem or Aetna or whoever the provider may be, I have to provide an application. I also have to provide proof of E&O insurance. And I think if these people or navigators or whatever we're going to call them are going to be out there and enrolling people, that they should be held, again, to the same standards and have to carry E&O insurance. And I would say that that's going to be a big nut to crunch from a budgetary standpoint if the health insurance exchange program is going to have to purchase that for those employees or whatever their funding mechanism may be. Thank you.
Thank you. Thank you very much. At this time, I'm going to close public comment. We have about 15 more minutes in the room, and we have quite a bit more to get through. We have discussed this a bit, and I do want to get to the motion that is currently on the table. Ms. Ellis, if you could restate your motion, and then I'd like the committee to vote, and if we need to do a roll call vote, Mr. Bowden can take care of that.
Thank you. TV Ellis, for the record, my motion is to allow producers to enroll in the Silver State Health Insurance Exchange to be licensed as proposed by the staff, that it says, and I quote, producers will be licensed in the same manner they currently are with the Division of Insurance. To allow navigators to enroll in qualified plans of the exchange and Medicaid eligibility, and to be trained and licensed by the DOI according to what our executive director recommendation was in partnership with the DOI, that the new license will be created for the navigators to meet the standards necessary, and to allow and approve assisters to be one additional category of education and outreach to be trained, tested, and certified by the exchange as proposed by the staff.
Thank you, and that motion was seconded. We have had discussion, we've had public comment. I'd now like to take a vote. All committee members in favor, please say aye.
Aye.
Aye. Aye. All opposed, say nay.
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 Can we, Mr. Bowden, can we take a roll call vote?
Absolutely. For the record, C.J. Bowden. Chair Atkins.
Aye.
Mr. Downey.
Aye.
Ms. Ellis.
Aye.
Ms. Joyner.
No.
Mr. Mazzoni.
No.
Mr. McCoy.
No.
Ms. Parati-Boothman.
Aye.
And that is all in attendance.
Is that 4 ayes and 3 nays?
Correct.
All right, the motion passes. Can we take a moment here, please? Okay, with that, if I could open up the, I want to continue on this item. I know Mr. Bowden didn't have a chance to talk about producers, and I think that's because we had a motion on the table, but we've kind of resolved that issue at the moment. If I could ask the 3 committee members who voted no to, and I know that motion has passed, and that will be the recommendation to the Silver State Healthcare Exchange Board, but I would like to ask the 3 committee members who voted no if what particular piece they would either like added to that, because again, the motion was, I know, very early on in the discussion. So if I could ask Mr. McCoy, Ms. Joyner, and Mr. Mazzoni to comment.
This is Tom McCoy, and perhaps I should have asked for a point of information. I'm assuming that what we accepted with the motion was the recommendation set forth in Table 1, and I still have a concern on the unbiased explanation of coverage, so forth and so on, not offer any opinion or editorial. I was not seeking opinion or editorial. I was seeking some method by which educated advice, however you want to term it, can be given, whether we're talking about options or whatever. We got into a lot of discussion on that. But from a chronic disease standpoint, which is what I deal with every day, I do not feel that this, as passed, is going to take care of some serious situations in Nevada.
Thank you, Ms. Joyner.
Thank
Was
you,
it the particular definitions and clarifications?
It was those reasons, yes. I think one reason that I may not have voiced before the most recent vote is that it appears with this model, which I just had a chance to look at today for the first time, this addition of assisters, it now appears to me that we'll have a category where navigators will be, and although I understand through clarification that they will be slightly different than brokers or agents as far as being licensed through the insurance division, if they have to carry errors and omission liability insurance, I mean, for all intents and purposes, they are a broker or an agent. My concern then is this huge gap that we will have between the assisters who can do almost nothing but go out and give presentations and a full-fledged, essentially newly named broker. I had envisioned the model being more where there would be referrals to brokers and agents. So for me, it was just too much of a gap there in the middle.
And if I can make one comment to that, because I know I think Mr. Hager alluded to it, and I think as we keep talking about this, that this is a new program, and it is my understanding that the Exchange and the Department of Insurance or Division of Insurance are going to be coming to be deciding what those new regulations are for navigators. And so I as well am concerned that if the navigators are required to have the exact same licensure as the brokers, that it's kind of going to defeat the purpose. And I think it's kind of as we've been the entire time, it's the chicken before the egg. I mean, we just, so much we have to decide without knowing every single detail of all of this, because decisions need to be made, and then we need to kind of go back and look at some of the things. So, but about that issue, my understanding is that decision on what exactly the requirements are going to be, that the Division of Insurance and the Exchange is still going to be working through. And I think to Mr. McCoy's point, I think those are details that can definitely be woven in. I don't think the members that voted yay meant to exclude any unbiased discussion about catastrophic illnesses and choices. So I think that is still kind of like details that can definitely be added. I think the goal for today, and I know Mr. Mazzoni hasn't spoken yet, but I think the goal for today was, are navigators going to be able to enroll? And I think I think that is where we ended up. Mr. Mazzoni?
Dwight Mazzoni for the record, and I would rise to a point of order. I understood from direction of the chair that we were actually voting upon the draft document that was sent to us last night, and that's what the motion was based upon, not on table 1. Right. And I would like clarification so that we have that for sure. Is that exactly? We voted for this document, not the table 1 document. Mr. McCoy, I think that resolves part of your issue. Unfortunately, we're only going to know if this works, if it works, and if it doesn't work, it ain't going to work. And we're walking this fine line between navigators, producers, assisters, or enrollment navigators, whatever you want to call them. Although Mr. Hager's gone, so he can't appreciate that humor. Some people can, probably. My concerns are much the same as what some of the people have voiced. I voted against this because I think, like, I'm not sure, I apologize, the name of the lady who spoke last. We have this huge gap. What is really an assister? And this is something brand new. And for those of you that aren't aware, this was, I first saw it at 6 o'clock this morning, trying to wake up and figure out what I was going to do today except go to state meetings about health insurance. So I think that we've done a lot of work. I would suggest that with some trepidation that we suggest to the Silver State Health Insurance Exchange Board that while we have voted in favor of this, that this is not cast in stone. This needs to be really deeply looked at and could be modified again, and I don't think our job is by any means done. But maybe if everybody here will go along with the idea, including the board, that we now at least have a starting point, and I would hope that we have enough guts to stand up and say, wait a minute, that dog ain't going to hunt in this fight, and we're going to have to figure this out a little differently as we go along, because we're all going down a path that we've never been down before. I know we're trying from our end of the business, from the insurance end, trying to protect what we conceive as our livelihood. I understand Peggy and other people are trying to do what they know how to do and what Mr. Downey knows how to do, which is to try and get out and get as many people enrolled as you can in programs, which I applaud. I think that needs to be done. But we are by no means, is this vote today or what we've determined today, the end of this particular tightrope that we're walking. We got a long way to go, and I would ask us all to please keep an open mind on that. Given that, I keep my vote as no, but I will fully support and work hard on any things that we can do, particularly with the board of the Silver State Exchange.
Thank you very much, and I know we still have a couple more agenda items, but I want to thank everybody. I agree, we kind of had to get a starting point. We had to move on and get a starting point to the board. I'm assuming the board is going to have questions, and whether or not they approve this or have lots of questions and send them back to this committee, and as we start fine-tuning anything, but at some point we kind of just, we needed to move forward, and the questions can continue to come, and we will refine and we will discuss and we will continue to work with everybody. And we do want this to work for the state of Nevada. We want the people in the health insurance industry who have been doing this a long time to continue. The agencies that are helping those now who are uninsured, we want them to be able to continue to help people. So I appreciate everyone's comments and appreciate that we have moved forward at this time. So with that, I am going to close agenda. Yes?
Adam Plain from the Division of Insurance would like to make one last comment, if that's all right.
Yes.
For the record, Adam Plain, Insurance Regulation Liaison, Nevada Division of Insurance. Madam Chair, just to clarify about the licensure requirements and whether that leaves a gap in Nevada's potential outreach programs. The Federal Register, Volume 77, Number 59, page 18,331, indicates that states cannot, by law, require navigators to hold errors and omissions coverage. So that, in combination with the licensure requirement, I believe may alleviate some of your concerns potentially for future consideration.
Thank you. I appreciate that clarification. At this point, I'm going to close agenda item 6. And Mr. Bodden, I think we wanted to go back to agenda item 5. Is that Mr. Hager, I see?
We're back. For the
He's
record,
missed all the fun. You've missed all the fun.
Oh, I got some of it to begin with. For the record, John Hager, agenda item number 5 is the Consumer Assistance Inventory Report that we have been promising for a bit now. Generally, the Public Consulting Group went to various state agencies, various nonprofit organizations throughout the state, and basically inventoried their capacity to help provide consumer assistance. It gives us an idea of what entities might be available to be navigators or to assist the outreach effort. It talks about largely about what their capacities are, phone volume, number of people that are served, wait times, things like that. So it gives us a better idea of, number one, what organizations actually have capacity in their current systems, or the other potential is that the grant funding that we could provide for navigators, and I think that's what was approved at the last meeting, that the navigators or the assisters would be eligible for funding to help improve some of that capacity so that they could assist us in getting the word out as well. It's a fairly involved document, 70 pages, 60 pages, 56 pages, 57 pages. So I'm not going to go through the whole thing, but if there are any questions that I might be able to answer, I'll be happy to. Additionally, I believe Tyler Covey from the Public Consulting Group is on the phone if there are questions for them as well.
Madam Chair and John, just a couple of points. Clark County Health District doesn't exist. Southern Nevada Health District does. But I think that the major missing link, if you would, that I saw is that they really didn't contact health organizations, nonprofit health organizations in the state. Health, lung, cancer, heart, organizations like that were not contacted at all.
Thank you. Mr. Mazzoni?
Dwight Mazzoni for the record. Could we go back to the comment made by the gentleman from the DOI a minute ago about page 18,000, whatever it was? Sir? You stated, and I realize that is in there, that the navigator could not have errors and omissions. Is there any mention in registry or any of the verbiage, any place that you can find, that allows or shows what liabilities may be incurred by a navigator or not, or are they exempt or above the law or whatever? I'm not sure, and I don't mean that to be a catty remark. I really don't. But we're excluding somebody who's providing assistance to a consumer from having to be covered for a possible liability situation.
For the record, Adam Plain, Nevada Division of Insurance. We have not noticed anything in the Federal Register that indicates what liability navigators may be subject to. It is an area of concern for us as to how it's interpreted and where it goes from here, but we have not received any indication from the federal government as if there are any superseding statutes or rules that may come down.
Thank you, sir.
Thank you. With that, if we can close agenda item 5 and move to agenda item 7. Mr. Hager, there's 2 items that I would like, I think on the next agenda besides whatever we may not have gotten to on this agenda, which I'll leave that to you. I'm not sure when this group should start talking about grievances and appeals and what that means and what it is and how it might work, but I'd like to get that on the agenda. I'd also like to take another look at the budget that we are talking about for navigator programs. The number sounds small to me, so I'd like to take another look at that. And I guess one other comment, just in general, that I'd like to kind of take a look at also. I know we've had a couple people comment over the last couple of meetings. It seems like the agencies that are treating those who are uninsured, whether it be emergency room or social service agencies, that really are kind of ground zero on uninsured, it sounds like from what we've learned that they are not able to participate in the Navigator program because they are compensated in some way from health insurance companies. But I don't know if they can be assisted. I don't know where they might fit in or how it might work, but I don't want to kind of leave that issue on the table. I think that's where so many folks go who are uninsured, and we need to think about working together, again, with the emergency rooms and social service agencies that see folks who are uninsured. So I don't know if that's an agenda item or just a comment from me. So, Mr. Hager, do you have any other things for agenda item 7?
Not off the top of my head, no. One comment about the providers. There's nothing that precludes us from allowing providers to be assisters, so they could assist in the enrollment of individuals in insurance. One thing to keep in mind that this is a little bit different from our enrollment procedures are different from Medicaid enrollment procedures and indigent care, where indigent care, the provider is reimbursed by the county, probably 10 cents on the dollar. The Medicaid, there are some rules about Medicaid, but generally they can get enrollment in Medicaid. For the exchange, there is at least, at a minimum, a 15 to 45-day waiting period. If you're in open enrollment. If you're outside of open enrollment, you have to wait until the next open enrollment period to get to get coverage. So while I do think that we should allow providers to be assisters, or at a very minimum to have, any provider could put a laptop or a computer in their office and say, here, sign up for insurance. Certainly don't have anything against that, but the individual would not be able to get insurance for that day's worth of coverage.
No, that makes sense, but I guess just wanted to keep that conversation going. With that, we are getting ready to close. Is there any public comment to close the meeting? I welcome it. Mr. Downey, is there any public comment up north?
There is.
Great. Please state your name.
I'm
and
sorry,
agency.
Madam Chair. No, I just need some clarification on something that I've heard. Is it true that if you are receiving a subsidy from the government, that you are only eligible to enroll in one plan design, like the silver plan design, or are you able to enroll in any of the 5?
To receive a subsidy, the advanced premium tax credit from the federal government, you need to enroll in individual coverage in the exchange, whether that's platinum, gold, silver, or bronze. It could be any of those coverage options. The tax credit is pegged to the second lowest silver plan. So whatever is the second most inexpensive plan on the silver tier for you, you will get a subsidy based on that plan, and that amount of subsidy will follow you depending on which plan you choose. So that if you want to purchase richer benefits in the platinum plan, you can purchase that additional benefit, but 100% of that increase in cost would be paid by the consumer. You would only get the tax credit that is pegged to that second lowest silver plan.
Okay, thank you. So what you're saying is the potential for people to be in the silver plan is much higher than some of the other plans if they're receiving subsidies.
And it would actually be, well, it would depend on the education that all of you provide. Because it obviously depends on the plan design and the premiums. The potential would actually be that people would be more likely to purchase a bronze plan, which is even more inexpensive. And one point of clarification, while the subsidy is pegged to the second lowest silver plan, it is no more than the amount of the premium for whatever plan that you choose. So you could choose a bronze plan and have no premium if that's the calculation. So it's all up to all of the brokers and navigators to provide the proper education so that they choose the plans that don't end up with large out-of-pocket expenses later.
Okay, one more question to Tom McCoy. I'm sorry.
Quickly.
To Tom McCoy.
And because we try not to have this be a question and answer session, and I think we made an exception for you.
Oh, thank you. His comment on serious medical conditions. I know we are bound by HIPAA laws, and I know some of the nonprofits are bound by HIPAA laws, but I do not believe that all are bound by HIPAA laws. How is that going to come out with the nonprofits that are not? Thank you.
Thank you very much for your comment. At this time, I am going to adjourn the Consumer Assistance Subcommittee meeting. Again, thank you to staff, thank you to the public, thank you to the board members, thank you to the Deputy Attorney General. Thank you to everybody.